All right, good afternoon, everyone. WTOC Syria Sandlin here, joining you from the studio for the beginning of what is going to be a great informative series we are doing for here at WTOC. We want to make sure all of your questions are answered about the COVID-19 vaccine. And joining me now is one of the principal investigators for the Moderna Vaccine Trial, local physician, Dr. Paul Bradley. Good afternoon, Dr. Bradley.
Hi, everybody. It's a pleasure to be here.
Thank you so much for joining us this afternoon. We want to go ahead and get started because we want to take a lot of questions from our viewers and just give everyone the chance to get answers that so many of us have. So, first, let's just explain your role in the trial and what you've been up to the last few months.
Yeah, it's been obviously really busy. Um, we uh, we actually started. This is amazing. Uh, when the world was still trying to figure all this out, Moderna vaccine companies literally watch for any emerging disease. That's what they do. And although it was probably late March, April before most of the world figured out, hey, we have a real problem. Moderna actually noticed noticed the outbreak back in December of last year. By January, it actually decoded the virus because everyone thinks this all just happened, but this has been a work in progress for almost a year now. By February, it had already begun phase one clinical trial, which is really small, just in a couple of places. By April, phase two had already started, and we were part of phase two. There were 10 sites, 600 patients around the country. And clinical trials tend to usually have three phases, one, two, and three. And then those results were looking really good. And so July of this year, we began phase three. And we had the great honor with Dawn Baker being a very, very first person in the whole world to give that shot. They kicked off phase three for Moderna, the first COVID vaccine to be administered in the trial. That we blew things up, literally. We went from 600 patients in phase two to, for Moderna alone, 30,000 people around the world. And shortly after Moderna, we gave that first dose, Pfizer began their trials, and we also participated in the Pfizer trial. Again, Pfizer now is up to 45,000 people around the world in their trial. And then shortly after that, we began another trial for Novavax, another company. So at this point, over 1,000 people in the local area have heroically volunteered to be in our trial, and we've had a lot of experience.
Wow, that it's amazing that tens of thousands of people across the world are part of these trials. So I think one of the questions a lot of people have, how did we get so quickly from those trials to people receiving the vaccine as of this week?
Yeah, it's the, the government really named this appropriately. It was called Project Warp Speed, and they facilitated in a way they've never done before the development of this vaccine. No shortcuts. I know everybody's worried it happens so fast. No shortcuts. I promise you. I've done clinical trials for over 30 years, and vaccine trials for over 10 years. The reason we were honored to get these trials is our prior experience. Um, uh, the uh, the oversight was more than I've ever seen. Everyone thinks, well, they must have just rushed it, but it was actually totally the opposite. It was just beautifully choreographed at every step of the way. Instead of waiting for things to happen, waiting for things to be approved, which is typical in the world of research. That approval was ready. It may not have been positive. It may have sometimes gone backwards, but the oversight was there. Every step and every roadblock had been removed, and at the same time, it was choreographed by a whole number of organizations. Everybody looking, everybody watching, making this thing happen again at warp speed.
So I think that's the biggest thing. People think it's incredible, but they're skeptical that this vaccine came so quickly, less than a year from the start of the pandemic.
Right. Well, yeah, but I understand it because when we didn't talk about the much in the way of the vaccine trial until this summer. But again, that's why I said it's really important to realize that it really began last year. Even though the world didn't recognize it as a problem, this wasn't new. And although everyone thinks the technology which is being touted is new, it is new for this application, but it's not new as well. And in the coronavirus, even though this is an unbelievably deadly, I mean, literally evil bug, it's really not that much different than the previous coronaviruses that have plagued the world
Oh,
every decade or so.
wow. So, one question I know that a lot of people have and are concerned about, they're wondering what is in this vaccine? Is this going to give you COVID?
Yeah, and it's really important because there are a number of myths, and I get them every day in the exam room. You know, my main job is I'm an internist. I'm seeing patients here in Savannah, and I every day. And it hasn't. I hate to say it, it hasn't gotten any better, and that's why I'm glad to be here with you. I'm trying to uh, preach the gospel. For one thing, the most common misperception I get is that we're going to change your DNA. Okay, the vaccine does not do that. It doesn't. It very elegantly trains your immune system to recognize the foe. Okay, the coronavirus. And you say, well, what does that mean? Well, vaccines in general are picture postcards of the enemy. So I always try to tell you, and y'all probably heard me say this before, but if you had to go to war, and if you didn't know what the enemy looked like, you'd have a very difficult time, right? You wouldn't know who to shoot. I mean, you may have all the latest guns and weapons and tanks, but if you didn't know who the enemy was, you'd have a hard time. You'd probably shoot the wrong people too. So what a vaccine does, because your body has never seen COVID-19 before.
Hmm.
And so if it gets attacked by COVID-19, it's unaware. At some point, when you start to lose, your body will figure it out and start to fight back. But along the way, it'd be really nice if you already knew what the enemy, who it was, and if under the best circumstances, you could be ready for the enemy. So a vaccine is here. This is what what the bug looks like. Well, in the case of the COVID-19, the germ, even though it's incredibly deadly, is actually very simple. And everyone at this point has seen a picture of it. It looks like a ball with spikes all over it, right? And so vaccine only has to pick one part that you can always see. And that in this case is the spike.
Hmm.
Spike is always the same. Every time everyone sees a picture of the COVID, they see the spikes. And so these vaccines target or a picture postcard of that spike so that when you don't have to know the whole what the entire enemy looks like, right? Just their uniform or a piece of their uniform. And so you get, and you probably heard by now, most of the vaccines are two-shot series. So
Right.
very simply, you get a shot that is a picture postcard. It is training your immune system to look for, be aware of that spike. And then you get a second shot just to remind the immune system in case
Oh,
and that's what we call memory. And it wouldn't be any different if you were in school, right? You don't look at the stuff one time, you look at it
twice.
twice
Absolutely.
to really get it down.
That makes a lot of sense. So basically, what you're saying is you're not getting injected with the live virus, which I think a lot of people were worried about. So that makes
So
perfect sense. It's a
they're totally
picture
convinced.
postcard.
And the reason they think that is sometimes we do that. Some vaccines are we call them attenuated. They're beat up versions of the live virus, but that's not what we're giving you, and at least it's not the case for Pfizer or Moderna. Uh,
Absolutely.
right, and it's important to be aware of that. So in fact, there is nothing live in either one of those vaccines.
Good to know. I am getting so many comments. I'm watching this in real time. So thank you so much, everyone that's joining us right now. I see your questions and I'm going to start asking them. Dr. Bradley, by far the biggest question I've been getting is side effects. So I think right now you're about 36 hours out from when you got
Yeah,
your
yeah.
vaccine.
Let's see
First thing yesterday morning, you got your
where we at.
sticker.
I
Yeah,
got it. I got
you
it.
got your sticker.
I got it. Yep.
How
Yep.
are you feeling? And let's talk about the side effects because people are worried. There's been some rumors going around about some serious issues.
Right. So a little arm soreness, which I expected, is what most of the patients that we saw in the clinical trials complained of. Um, uh, Feels very much like in the past when I've had a tetanus shot. I got it yesterday morning, 6 o'clock, over at St. Joseph Candler. Um, Arm is still a little bit swollen. I can feel it. Basically I can live with that. And that is to be expected. Why? Because it's revving up my immune system, and when that was injected in my arm, so the pieces of my immune system have gone to the site and they started the process. I mean, it's not a bad thing. It's the vaccine actually working. Now basically the army is building.
What about this anaphylaxis? And we've had some rumors and seen some reports of 4 people developing Bell's palsy from the vaccine. What is that about, and what type of allergic reactions are you hearing?
Yeah, yeah, it's interesting because um, Pfizer, like I said, had I think 45,000 people in their clinical trial. We didn't see the anaphylaxis. That doesn't obviously mean it doesn't exist. And whenever you start giving any medication or vaccine in very, very large numbers, you're going to see some what we call one-off side effects. I mean, anaphylaxis is a big deal. And I mean, no one, they've treated each one of the cases. Um, uh, it suggests that those people were allergic to some component in the vaccine. I cannot explain why the 45,000 that went before didn't have that. But to be fair, half of the 45,000 got placebo, right? So it's really half that number. But no, we didn't see it before. But you can have that kind of reaction to literally any vaccine, any medication, and every medication is going to have that warning. We can. It gets to an interesting point that I wanted to be sure we covered anyway. Anaphylaxis is a big deal, not to be downplayed. I am I worried? Well, even if the number had been even more significant, I'm looking at it like this, and everything is a risk and a benefit. Right?
Hmm.
We've got 300 and something thousand people dead right now from COVID. We hit a new record again yesterday, but we'll hit a new record again today because we're paying for Thanksgiving now. Today, and hopefully this won't change. Today we have 0 dead from the vaccine, right? And so the odds in my mind, I had no trepidation yesterday morning. I know I do not want to be part of the 300 plus and growing thousand. Yes, there's always a risk, and if you aren't willing to take a risk, then honestly, at this point, get a bubble suit. Do not go outside and do not go near anybody. You can't catch COVID from nobody, but everyone else is an opportunity.
Absolutely. And have you heard anything about the Bell's palsy side effects?
Yeah, we see a lot of Bell's palsy. So Bell's palsy is temporary paralysis of the facial nerve on one side. You don't die from Bell's palsy. You look like you had a stroke. It's not a stroke though. It doesn't have anything to do with your brain. Um, uh, we'll see a Bell's palsy several times a month. We really don't understand why it happens. It almost always is a temporary condition. It's miserable because you can't move part of your face for usually it's weeks, maybe longer. It was a handful of cases that were seen. There were, I think, at least in Pfizer, placebo people also had, I think, Bell's palsy reported, but it was a few more in the active group. It's another risk, maybe. We don't know. I mean, it can all be, those numbers are so small, it might be just coincidence. But again, it's not dying from COVID.
Exactly. This is an interesting question. Let's talk about who and when this is going to be available. I was there yesterday at Candler, lines of doctors, nurses, hospital staffers getting the vaccine. That's our first priority. People like you, people on the front lines that are treating people every single day. Moving forward, when are people not medical workers going to start being able to receive this vaccine?
Yeah. So they want to do medical first, and because hopefully you want your medical worker to hang around to be able to treat you, and just as importantly, you don't want to go to your medical worker and get COVID from your medical worker. So they'll hopefully get us out of the way and the super high risk population, the nursing home people out of the way. And I'm pretty sure simultaneously they're working on the front line, the paramedics, police, firemen. We need them vaccinated as soon as possible. Then we'll move, from what I understand, and it's a complicated answer because apparently it varies state by state.
Right.
I don't think we have yet all the answers that we've heard yet for Georgia. Then there'll be a tiered approach. At the moment, in Savannah at least, it's the health department and the 2 hospitals that have the vaccine.
Mhm.
We're told that they'll be giving it to doctors' offices that have signed up, and we've definitely signed up, and we anxiously await them to send us vaccine. When we'll get it, I'm not sure. Because we've done all the research and we have the special freezers, we could actually take the Pfizer vaccine here, which has the special storage requirements. But I imagine that for the most part, it'll be the Moderna vaccine that gets distributed.
Because that requires less refrigeration, correct?
Yeah, only as far as I understand that only Pfizer has the very, very cold storage requirements.
Absolutely. Another really good question, people kind of talking about the flu shot. I see someone is asking, how much is this going to cost? As far as I'm concerned, the US government is taking the bill for this one. This should be free to all Americans, correct?
It should be free to all Americans. The government fully paid for it. I think what I understand is there may be a small charge depending on who gives it, where you go to administer it,
Absolutely.
which if you do have insurance, in all likelihood would be covered by the insurance.
Great. This is a really good question that I haven't thought about. Kimberly's asking, is this going to be a yearly vaccine like we have to get our flu shots every year?
It's a really good question. And the answer is stay tuned, right? We don't know. The talk ranges from every 2 years to every year to lifetime. We don't know. The studies that we're doing don't end; they're ongoing. They're 2-year trials, and it's one of the things that we'll be looking at and have to answer.
I want to wrap things up here in just a couple of minutes, Dr. Bradley. We know that this is the light at the end of the tunnel, but it's only the beginning of hopefully getting our lives back to normal. But there's a caveat to that because it's going to take a lot of participation. Explain how that's going to work. I mean, the last I heard, we need about 70% of the US population to get this vaccine to get back to normal and maybe not wear masks anymore. Is that
Right.
correct?
Yeah, you're absolutely right. That's that magic, we think, herd immunity number where somewhere 70% of everybody gets it. And it's not adequate for everyone just to get COVID. We need 70% of everybody to get the vaccine. Because remember, even if you've had COVID, you have the opportunity to get it again. And in fact, as time goes by, your immunity is dropped. You probably will get it again if you're exposed. So we really need every 70% of everyone to get the actual vaccine. And just like polio and smallpox and all the rest, as soon as you vaccinate a large number of people, then there's no one left to spread it. And then it slowly fades out. And we
So
really need that because I mean, these death rates are crazy. These are, I mean, I tell everybody, I mean, this is the plague, right? It's unbelievable the number of people that are sick. It is absolutely, our area, where's our mayor? Because I always give him credit. We have been an exceptionally low risk area.
Mhm.
However, it's terrible even here. I mean, our hospitals have, unfortunately, lots of COVID patients, but they're not busting at the seams. Our ICUs are not overflowing. But in large areas of the country, especially big cities, I mean, this is a disaster. We're so isolated that I think it unfortunately makes us less likely to get that call to action.
Mhm.
But it's, I mean, just open up the newspaper and you don't have to see what people died from. Just notice that the obituaries have gone from, a quarter of a page to several pages. I mean, it's bad. Are they all dying from COVID? Honestly, a lot of them are dying as a consequence of the incredible stress that COVID brings. Some of them are dying from COVID. We're lucky here so far, but we need everybody to be motivated to do 2 things: get a vaccine when they can, but most importantly, right now, wear the mask. They've
Mhm.
got to wear that mask.
The
It's,
masks work, the science is there.
it's there. You need to wear it for yourself, and you need to wear it to protect everybody around you. Because
Absolutely.
you don't know if you have COVID. You really don't. We've seen that time and time again.
Mhm.
The asymptomatic person.
Yesterday, when you talked to me, you said, this is an awesome day. I'm seeing an excitement in doctors and nurses that I'm talking to that I have not seen since the beginning of this, that I have not seen all year. I guess just to close, just tell everyone why you are feeling optimistic and happier right now, looking forward to 2021.
Yeah, I mean, it's really simple. If we didn't have this vaccine, I mean, until a crazy number of people had died, millions, there was no reason to think that anything different was going to happen. This actually totally changes the game, and it's the only possibility other than crazy death rates for people to change the game. It is absolutely our future and everything we needed to happen.
All right. Thank
Um,
you so much,
so
Dr. Bradley.
I got to throw in a quickie. They all want to know. So, what did you do after you got the vaccine?
Oh,
Uh,
yeah.
so, what did you do? So, I have this as unabashed. I get my freebie in here. I called my nephew who owns Cotton and Rye and made a reservation for 4 weeks.
Zach.
Zach, that's exactly right. I said, Zach, put me on the calendar. I know I haven't been there. It's hard to go out. It's hard to eat with a mask on. So the cool part about getting the vaccine is 1 week after your second dose. Okay, so for Pfizer, that's 4 weeks from your first dose. You have a 95% chance of not catching COVID. Period. And according to the Pfizer data, you have 100% chance of not getting seriously ill.
Wow. So
So,
encouraging. So I'm
for one
excited for
month from
you in
now,
a few weeks. You're going to be going out to dinner for the first time in
that's it.
a
That's it.
long time. And you deserve it after all
How
of
about that?
your hard work. Thank you so much for
Thank
Dr.
you.
Bradley. You're
Thank
going
you
to stay
for my
on
work.
and you're going to talk to our colleague, Jake Wallace. But thank you, everyone, for joining us. We're going to continue doing this every other week. So if you didn't get your question answered this time, we're going to be back the week after next with more answers for you. We appreciate you, Dr. Bradley, and
Thanks,
keep
Dave.
up the great work in our community. Thanks, everyone, for tuning in. We'll see you soon.